is Heather Dolan. I am a registered nurse. I've been at MUSC since 2006. I'm currently the clinic manager for pediatric endocrinology and developmental peds in Rutledge Tower. But I did start off in the Children's Hospital in pediatric cardiology. So I'm also on the magnet steering committee, and Kelly Hannon is my colleague over here who has helped me a great deal with getting this Pep Rally together. So this is not going to be a whole long, drawn-out presentation for you this morning, because I want you to have a chance to talk to each other, to ask questions a little bit too, because what we're really going to start doing is taking time in these Pep Rallies to connect back to purpose for what we're doing, so that this magnet model isn't some pie in the sky that doesn't relate to what we do here at MUSC, because it does. So what we're going to start off with, how many of you have seen this? I'm so glad everybody raised their hand. If you have not, and if you know people in your units who have not, please make sure that you point them to this, because this is where all of the foundation is going to come from. We're going to start with transformational leadership. And this is actually something that I borrowed from Andrea in presentations that I've seen her do, because that's when I had the light bulb moment of how this really connects back for us. Transformational leaders are leaders that have a vision. They see something that they want to change, and they have a plan to deal with the unforeseen and the foreseen that can come up. Who are transformational leaders at MUSC? Of course, we have Dr. Schaffner. She's been visionary in getting this magnet journey started. And also, one of the things she wants to see happen is lateral violence to cease between nursing. Stuart Smith had a vision that he wanted to see our organization succeed and excel, and knew that magnet was a way to do that. So how many of you think regular, all of us, clinical nurses are transformational leaders? Not everybody raised their hand. I'm going to give you 2 examples. I know there are tons more, and I want to hear them, of 2 people that I know of personally who are transformational leaders. I'll just let you read that for just a quick second. So, sounds pretty cool, right? Jamie Nettles is a registered nurse in our pediatric neurology clinics. Jamie was transformational because she realized there was a need for better care of our seizure patients. Excuse me. So she worked with the PZD to come up with a program of how to better identify these patients and how to care for them and treat them. So this is now her RM3 project. So she's done a great job. Johnny Martinez found a way to include asthma education in some of these primary care visits for our primary care pediatric population. This has turned into huge, huge teaching opportunity for residents and interns. So he's taken the information, he developed worksheets, he worked with our pulmonology division, came up with asthma education plans, so that now we're targeting these patients, we're getting them done, getting PFTs done on a routine basis. They have a stoplight plan so that these parents know when the kid's in trouble, what they need to do, or how to maintain open, happy airways. The interns and residents said, we touched on it a little bit, but we don't really know what to do with this. So he was able to take this to them, and it's been a huge, huge collaborative effort. These are 2 nurses who work beside us every day, who are transformational leaders. Over the next couple of weeks, what I would love to hear from all of you are the stories of those transformational leaders that you work with. Because I know we have an organization of 2,500, close to 2,500 nurses. I know we have tons of transformational leaders. I would love to hear your stories, because that transformational leadership leads to structural empowerment, which then we put into professional practice, which then we have new knowledge, but then we have outcomes. So that's how it all connects back to our purpose. So you are a transformational leader. Any questions about that transformational leadership piece? So I have a couple of experts in the room as well. So what I wanted to do is I wanted to share with you some of the magnet communication boards that we've seen throughout the hospital. This is just a brief snippet of some of those boards. You guys have really done an outstanding job. All your unit magnet champions, please give them a pat on the back because they have worked really hard to make sure you have the communication. They've been coming to meetings. They email Andrea, what do I need to tell them next? They're doing a great job, and so I just wanted to highlight some of the work that they've done. And of course, this is just a brief snippet. If you would like to highlight one on your unit, please email me. I would love to see it.
Where are these from?
These are, I have some from Art, and I don't have the exact ones on there. I apologize. I can go back. I will let you know where these are.
Does anyone recognize this one?
I have Art, IOP, I have Children's Hospital, and I have Maine, so I do have a snip from everywhere. But this is great. I love the scrolls because this shows where we were and it shows where we're going. So, why magnet matters. Let's talk tenants. I really like this one because it breaks it down so concisely too. This one I love because this one also gives us the ability to see how we're doing. It gives us those graphs and those percentages so that everyone can have a look and say, oh, we're doing great here. Let's bump up this area so that we can be equally as great in that area as well. And then I love this title, Magnet, What's the Fuss? Have any of you felt like that? Have you heard magnet, magnet, magnet? The fuss is we have a chance to really transform nursing here at MUSC. And for me, that's exciting. We are such an integral part of healthcare, and we do realize that this magnet journey is going to include all disciplines of the organization and all disciplines of healthcare. But for us as nurses, we really have a chance to shine and show our talents and show our unique abilities as a driving force in decisions that are made for our patients. And that's what we're here for, is patient advocacy and patient care. So find the magnitude in you. Okay? That's all I have. I'd like for you guys to have some time to talk among yourselves, ask questions, enjoy some chicken minis. We do have our t-shirts down here. So if you order t-shirts, come and pick them up. And we have our magnet brochures. I'd like for all of you to have one of these to take with you too, so you can share these on your unit.
Good morning, everyone. I'm Andrea Coyle, the Magnet Coordinator and Nurse Alliance Chair. Been a nurse for 18 years. And first of all, I want to manage up Heather, who she did mention she's the clinic manager in Rutledge Tower. But she and Heather worked together and did a lot of this on their spare time and did a great job. So, and I also would like to remind everyone to please go back. First of all, Unit Magnet Champions, you are all transformational leaders because you are influencing and guiding and challenging everyone in your area to be the best that you can be and be the best that we can be as an organization. So I just want to kind of connect that back to purpose. And also, I want to remind everyone to please go back to your areas and use your transformational leadership skills to encourage everyone to fill out the employee commitment survey. Very important. Has everyone filled it out yet? I see a lot of head shaking, yes. You know, that's one of our goals for Magnet, is to engage nurses by filling out that survey. And next I want to introduce Natalie Ankney. I want to allow her to come up and say what she wants to say.
Hi. I'm Natalie Ankney. I manage the Heart and Vascular Center, and I also am a co-chair with Janet Byrne of the Magnet Communication Committee. Today with me is Linda McDaniel. She is one of the, what's your official title?
Media.
A media consultant, I apologize. She's worked primarily with the DDC, but she's going to help us, our Magnet Communication Committee, kind of spread the word about all the great things that are going on. And we have so many ideas right now, but what I'd really like to get out of today, we're going to try, one of our big goals is to capture a lot of the things that are going on video that we're going to use on our website and really be able to promote things that areas are doing. It would be great if a couple of you or all of you might come down for a couple of minutes so that we can get you on video talking about why you're a part of this journey, what excites you, what you're doing in your areas, things like that that we will hopefully be able to use as we're building our webpage and making it a more dynamic spot. We need these so that people will continue to go back. We need more media, I guess. So if you could do that while we're here, we'd really appreciate it.